Welcome to DPC Pediatrician. We're Dr. Phil Boucher
and Dr. Marina Capella, two DPC pediatricians who are on a mission to share our love of direct primary care with you.
Hey everyone, welcome back to another episode of DPC Pediatricians. Today we are going to be talking about a very common question that I think lingers on people's minds when they are considering starting their practice, growing their practice, and that is the issue of the needs of our patients and their parents. Sometimes people worry, probably frequently worry, that they're going to start this DPC practice and they're going to be inundated with really needy parents and patients. If we can be honest, it is often the parents that we feel are the needy ones, and the children are not always as needy. There certainly is the subset of special needs children that we'll talk about too, but I think oftentimes pediatricians worry less about those kids and more about parents that are demanding or that have a lot of expectations or a lot of questions and concerns. And so, Marina, I want to hear from you what your thoughts or what your experience has been like with both sets of, if we're talking about the high needs parents that have, typically growing and developing kids with the routine kind of illnesses and questions of childhood, and then separately those children that have complex medical issues or are more special needs or high needs in those regards.
Yeah. So first, regarding the high needs parents, I would say yes, but I have not found that I've attracted more high needs parents than I did when I was in other practice settings. There's always just going to be a subpopulation, a certain percentage of parents that are more anxious, more worried, have more questions. I have noticed, though, now that I've been in this for 2.5 years, those families who were more anxious, more needy, had more questions, just, needed more of my time in the beginning. Over time, I think they've sort of calmed down because we've developed that relationship, and they don't have to have that anxiety of like, oh my gosh, I have to remember the 100 questions I have for my pediatrician and ask everything because I don't get a chance to ask them outside of the visit and I have to remember everything now. Right. And then also just over time, I like to think I have a pretty calm demeanor when it comes to parents, and there's something calming about, them coming in, time after time and just feeling cared for and feeling that their questions are going to be answered. And that even if sometimes because sometimes I get really complex questions and I don't have answers to everything, right? That happens to all of us. But even then, they still feel cared for, and they know that they can rest assured that I'm doing everything that I can to find answers or to help their child. And that just kind of brings, a lot of that tension, a lot of that anxiety down over time. And so I have found that those certain families that were or parents that were particularly more needy or anxious in the beginning, over time, it tends to calm down quite a bit. So
I've noticed
go ahead.
Exact same thing for me. I think that it's episodic. Sometimes they'll have a spell where they have a lot more questions and concerns. But on the whole, I would say that parents are always like, I'm sorry for having so many questions or being so needy. And I'm always like, you're not even in the top 10 when it comes to needy families when they have a period of illness or something along those lines. I think we're able to help them so much more easily, especially in part because of text messaging, that it doesn't rise to the occasion. And I also think that one of the things that we don't necessarily take into consideration or think about in advance is when it is so much easier to access your pediatrician via online appointment scheduling, via text message, via email, via the ease of getting in to see your DPC pediatrician, that it's calming in and of itself, because I, as the parent, know that I'm going to have time given to me when I need it, rather than I'm going to have to call, I'm going to have to wait on hold, I'm going to have to leave a voicemail and pray that somebody calls me back today. Like, it's just totally different experience from the parent side of things, that I think that in and of itself lowers the anxiety. Like, I know somebody's going to be there for me. It's almost like AAA. Like, well, if I get a flat tire, I'll just call AAA. Like, I already know I have that figured out. Something along those lines gives you that calm that comes from, if something comes up, I know that I'll be able to get it addressed. And then kind of to your point too, checkups are actually a lot faster because they don't hold on to all of those questions, because they're like grasping for every little bit of care that they can get. And they come up for their 4-month checkup and they have a list of 72 different things to go through. Well, when those
Uh-huh.
came up, at least 64 of them, they just texted, or we talked about it at the last visit because we had a long time to chat, and I gave them extra anticipatory guidance because I knew that they would have these questions coming up, or they just felt calm and easy about it and knew that if this comes up, I know that I'll be able to reach out. So it actually makes for faster visits, I think, in terms of the parents' questions and concerns, because we're able to touch base on a regular basis. And a lot of those kind of random questions, they just text us and we just text them back when we have time. It's often like, hey, this is not an urgent question at all. I was just wondering this. And then I can be like, okay, here's what you do. And then it doesn't come up at the checkup because it's already off the list at that visit. And so I think that those are two different ways that you might not consider that actually the patients aren't all that needy. And we haven't got to the point where we've ever said, hey, you're asking too many questions or you're overutilizing our services. Even for our families that I think we would recognize on the phone or when we see their text message come in that they ask more questions than the average bear, that none of them are taking advantage of us. None of them
Mm-hmm.
expectations that are out of the normal for their season of life or for their baseline anxiety and worry. And if they are, then we probably just need to talk to them about if they're getting the support that they need, because they're probably having a lot of untreated, unmanaged anxiety that's leading them there. And we can say, hey, we've noticed that you're calling a lot and you have a lot of these lingering questions. Are you doing okay? Like, how can we help? And it's usually not
Mm-hmm.
that they're doing okay. It's usually that they need somebody to tell them, hey, I think you could use some help. And we're able to kind of help them along in that way and make them feel heard and understood. Whereas if they're going to a large clinic where they're seeing 17 different providers in between all of their regular checkups, it's easy for those to get lost, or they just are just looked at as like an overly anxious hypochondriac parent, when really they're
Yeah.
just like needing more than
Mm-hmm.
they're getting. And we can be the ones to recognize that and then help them along.
Oh, definitely. Yeah, I definitely have had many parents open up about their, as I work with their child who is starting to exhibit signs of
Right.
anxiety or sleep issues, the parents start to feel comfortable and they open up about, I've struggled with this, my whole life, or
Totally.
I've been to therapy in the past. And sometimes they've gotten to a better place themselves, but sometimes they admit that they still struggle. And so we can be partners with them in terms of just gently nudging them to, take
Yeah.
care of themselves just as much as they take care of their children, because that can easily go out of balance when you have young children. Is like you prioritize the needs of your child, but you
Right.
don't always step back and see the bigger picture that, like, oh, my well-being is tied to the well-being of my children, and so I need to also take time for myself, and we can
Totally.
gently nudge that along. So to answer the second question of whether DPC attracts more high needs children, like children with complex medical needs or psychological needs, I don't know that it attracts more compared to a traditional practice, although I think it depends on how you market yourself
Right.
and what kind of niche you're trying to, get into. For me as an integrative pediatrician, I would say I probably do attract more interesting children. I think they're
Hmm.
interesting anyway, because it's all of
Same.
those cases with like all these complex diagnoses or like, unknown causes of problems. And sometimes parents come to me because they're frustrated. They say, I've gone to my general pediatrician and they're just not really like taking my concerns seriously. I know there's something wrong. Recently, I had a mom bring in her almost 2-year-old because he's been getting sick a lot. I mean, his first year in daycare, yeah, he got sick every month or two. And she was like, I know that's normal. But he was getting sick, like, for 2 months, every week being sent home with a fever. And something just
Mm.
told her that something wasn't right. So we did dig deeper and are still working on that. But because of that integrative pediatric specialty, I tend to attract more of those complex and interesting patients. But I actually love it. In my past life, in a regular practice, I did not love it. I did not love getting those
Right.
sorts of patients because
Because it
I
takes
did
so
not have
long.
the time. Yeah,
Right.
I did
Totally.
not have the time or the capacity to properly care for them. And now, because, I have much longer visits and I can a lot more time as needed, I don't feel that I don't have the time to ask all the right questions. I
Right.
don't feel that I don't have the time to explore things further, to do some research, educate myself about a new condition, that I
Right.
might not be an expert in. So I actually enjoy it much more than I used to. I enjoy getting those interesting and complex cases because it keeps my job interesting and it keeps me learning. And I feel like
Totally.
I'm able to help these kids and families who are desperately seeking help and wanting help, and they have had trouble finding it in other places.
I
So what about you?
echo
What about you? Do you
I would
attract more
agree. I echo
complex
everything that you
patients?
said. I think part of it is that you have more time. Like in my past life is like, okay, these visits are so fast. How am I supposed to do an ADHD eval in 15 minutes? And
Yeah.
now what I do at every single ADHD eval is I bring my iPad in and we talk through things and we come up with some visual things that they do. And the kid, like I give the kid my iPad, they write down something that they're going to do and then they make check boxes. And then we go, I hit print and they go find the printer and print it off. And then they have this thing that they take home where it's like a visual thing that they can practice. Just having the time to do that is really fun for me. And it makes a huge difference for the families to see it's not just about pushing pills. It's about like, let's try these strategies first and then follow up from there. So there's just kind of one
Mm-hmm.
example that came to my mind as you were saying, like in my past life, these were really
Yeah.
hard and challenging. And now it's just like you have time and I get to learn more. You talked me into doing autism evaluations, or you didn't talk me into that, but you did them. And then I was like, oh, Marina does them. I should do them too. And those are
Oh,
some of my favorite things to do, not something that you can do as a general pediatrician in a typical
oh no.
practice, because in the 90 minutes that you're doing your ADOS, you could see at least 6 or 7 patients, and the revenue lost in that 90 minutes would just wipe out anything that you could do to make up for it. But
Mm-hmm.
they're so grateful and it's so fun for me to get to do those. And that kind of speaks to our last episode about helping in the community. Like there's a community need for those, and that's something that we're able to do.
Mm-hmm.
Now, complex medical kids, I think, do great in the DPC model because we have the time to kind of be the quarterback that helps them with all of their different things. We have the time to call and make appointments for them. I mean, my nurse does that. I don't personally do that, but my
Uh-huh.
nurse will call and set up appointments for them or play kind of quarterback to make sure things aren't getting dropped or lost in the shuffle. And so for me, that's something where I really like taking care of those families that have complex medical needs. I'm thinking kids with neurological conditions or heart conditions or GI issues. Kind of those are like big
Mm-hmm.
3 in pediatrics, where
Yeah.
they're more complex and have a lot of different pieces going on. And so I
Mm-hmm.
love getting to take care of families that are like that. And they're so grateful to have somebody that knows their child. So when they go
Mm-hmm.
in for, their sick visit, it's not like somebody didn't realize that they have congenital heart disease or something like that because they see 17
Yeah.
different providers at their large clinic. Like we all know that they have congenital heart disease or they have bronchopulmonary dysplasia or chronic lung disease, whatever, all these different things. We know those things about them. So we don't have to like start from scratch of being like, oh, your kid is coughing. They always cough. Yeah, they were born at 24 weeks and like this whole history. We just are
Yeah.
able to skip that. So I think that families really appreciate that too. And it's really fun for me to get to interact with them, take care of them, and keep up to date, like you said, on what
Mm-hmm.
the most recent treatments and management options are, because I'm not inundated with seeing 30 plus patients per day. I have time to
Uh-huh.
do a little Googling, a little up to dating, a
Yeah.
little bit of looking at the journals and all those sorts of things to
Uh-huh.
stay on top
Yeah.
of that and figure out what works well for them.
Mm-hmm. Yeah. And we can learn about things that we didn't necessarily have time to learn about before. I think I saw you post
Totally.
recently on social media about pandas, which is
Yeah.
a
Oh,
sort of post
it does.
streptococcal
Right.
psychiatric issue that can develop. But some pediatricians believe it doesn't exist. And so they just kind of brush off concerns. But,
Right.
and it's not something that I really learned a lot about. I knew it existed.
Mm-hmm.
But I didn't really know much about it. But now I feel like if a patient comes with, some sort of complaint or concern about possible pandas, then I can say, you know what, I'm going to dig deeper. I'm going to learn about it. We're
Mm-hmm.
going to figure this out together. Right. As opposed to before when I said, well, go see a specialist who knows something about this because I
Right.
don't have the time. Right. Yeah.
And that's how
So,
I was too. And that like now, like there isn't a specialist in Nebraska for pandas anymore. And so those patients don't have anywhere to turn. And so then you can say, well, I'm going to learn more about it. Like I have a book on my iPad right there, like learning about pandas, learning about PDA, pathological demand avoidance. Those are things
yeah.
that I never had time for before.
Mm-hmm.
And now I'm reading like 3 or 4 books about it just to learn more so that I can help those families and educate families and be like, hey, maybe it's not that you just have a bad kid. Maybe your kid is not ODD like they were diagnosed by their pediatrician as. Maybe they have pandas or autism or PDA or RSD or all these different things that you just never took into consideration or knew before and never could have time to like pick out in a 8-minute visit.
Mm-hmm. Exactly. I was just going to share a story. I recently had this interesting case of a teenager who had an elevated copper level, and it had been tested because at her last pediatrician, she's on the autism spectrum, and mom had been reading a book saying, hey, micronutrient levels can be low or high in this condition. So she had asked her pediatrician to just check some stuff, right? And so by the time she came to me, she had this mysterious elevated copper level. And so at first I wasn't too worried. It wasn't too high. I said, let's recheck it in a few months. And if it's still continuing to go up, then we'll dig deeper. And so sure enough, we rechecked it a few months later and it was going up significantly. And so I had to do something. And in my last life, I would have hated this because I would have just been like, when am I going to have time to call the specialist and coordinate care and read and figure out what this could possibly be? And it can still be tough sometimes to come up with the time, but I knew I could do it. And so I like read about, what could cause it. I went down the Wilson's disease pathway and figured out, okay, what kind of testing do I need to do to rule out Wilson's disease? Because it's not something I see every day. And then I actually had time to call the toxicologist at my local academic medical center and speak to them and pick their brain about it. And then I also had time to call the peds GI specialist at my local center and talk to them and come up with a plan. And so we came up with a plan and we did further testing. We were able to rule out Wilson's disease, and we're just going to keep monitoring it because we were not able to figure out where this elevated copper was coming from. But we also determined that it was not nearly high enough to really cause concerns.
Gotcha. Oh man, I was hoping that like she was like had a side business of like stealing copper wire, and I thought there was gonna be like a really cool explanation for it. Or when you say copper, I think of Wilson's, and I think of Minkies, but I think that's copper deficiency. I don't remember.
But so anyway, but it, I brushed up my knowledge about copper stuff in Wilson's disease, and I was able to provide a lot of reassurance to the family because they saw this. Oh, it's like, oh, my doctor called and talked to all these specialists. They saved us from having to like spend money going to those specialists and spend time going to those specialists. And so they're in a much calmer place right now than they were. I also had another interesting case of a 4-year-old who had really elevated vitamin D level at 100. And usually we're trying to get those vitamin D levels up, of course. And that was a little bit of a mystery search. I had to investigate all the supplements he was on and all these other like weird homeopathic, things he was on and learn about those. And the end result was that his mom had been giving him camel's milk for a couple of months for a different reason. And apparently camel's milk is really high in vitamin D. And so when she stopped giving it to him, his level went back down to normal and he's fine. But I learned all these interesting things getting these more complex and interesting cases.
I think that, the other thing that I really love too is just the follow-up that you're able to do. And I think parents love the texting, and I honestly love the texting too, because it's so easy. Like we had a patient that had pandas and I wanted to start him on treatment for it. And I didn't want to forget about them and let them go for a month to then hear how things were going. So I just scheduled 2 text messages to go out. How's he doing? And then set that for next Monday. And then for the following Monday, how's he doing? So that we could check in on those things. And even just like another patient, kind of similar, just checking in over text message. Hey, I thought of your daughter today when I was listening to a podcast. How's things going? And getting to hear back, and just like those little touch points are really neat for me, because otherwise, like if you're seeing 30 patients a day, you're just too busy to do all of those little tiny follow-ups that can make a huge difference for the families, but also for my learning too, of like, oh, we did this and things improved. Oh, we did this, things didn't really improve. I'm able to like shift my thoughts and shift my treatment plans based on the things that I hear and learn from other patients that you would just miss out on if there's the whole rigmarole of, can you call and get an update on so-and-so, and then it has to turn into a note and it has to get to me. Then I have to read it and do all these things. Like were so many steps for getting a follow-up that it was almost not worth it. And now it can be just like a quick text message of, hey, just wanted to check in and see how we're doing. That sort of thing is just totally different in the DPC world.
Oh, absolutely. Absolutely. Yeah. So in summary, I guess, when it comes to both high needs parents and high needs children, I would say we do attract them, but I don't think that it's at a much higher level than it was before. But there's so much more satisfaction in being able to have the time and give the families the attention that they deserve to help them feel better.
Yes, you'll enjoy those families so much more, and you'll get to see when you've made a difference, because they don't just kind of like stop bothering you. It's because you've helped them that their anxiety and their needs are met.
Absolutely. Yeah. Well, thanks for joining us, and have a wonderful week.